Good afternoon and welcome to the Self-Collection and Primary HPV Screening Summit Debrief from the American Cancer Society's National Roundtable on Cervical Cancer. We're glad you were able to join us today. It's taking a few moments for people to log on, so if you want to drop your name and where you're from in the chat, we'd love to hear from you so you get a chance to meet all the other folks that are here. And we are going to get started with the presentation in 60 seconds. While we have you here, just want to throw out a few reminders. If you are not speaking, please put yourself on mute so that we can hear the presenters. And for this meeting, we're asking everyone to drop their questions in the Q&A. So just when you find the Q&A button on the bottom, just put your questions in there. We also would like to invite the chairs of the primary HPV screening work group and the self-collection work group to feel free to answer those questions or come off of mute when there's questions at the end. We will have plenty of time for that. And we'll go ahead and get started. It is my pleasure to introduce, my name is Shelley Dusick, and I serve as the director of the ACS Roundtable on Cervical Cancer. And it's my pleasure to introduce you today to our two speakers, two of the three tri-chairs for our roundtable. The first is Dr. Susan Vatoparampil and then Dr. Debbie Saslow. Susan?
Thank you so much, Shelley. And just wanted to add my welcome to all of you and what I think should be a continuing and ongoing conversation that started at the Self-Collection and Primary HPV Screening Summit just a few weeks ago, I would say. Next slide. So we thought we'd provide an overview that I think will set the stage for what we hope to get from all of you today, which is additional ideas, suggestions, and engagement of how to move our work forward. But to give you a sense of the summit and how that was run, we wanted to start with a little bit of background. We had 65 participants, and we met in Chicago, Illinois in February. It's hard to believe that it was that long ago. And I think what was really nice about this particular meeting was that we definitely had stakeholders from across the board. So researchers, clinicians, lab, IT, EHR, our government colleagues, and also our roundtable leadership. And I think one thing that I walked away from is it's going to really take everybody to advance change and to make things happen. And so we did spend, I love that we had 3 days to really discuss self-collection and primary HPV screening. The idea of the background for the meeting and the meeting objectives were to allow sufficient time and opportunities to network with experts to begin to really think about what are those tangible activities that it's going to take to tackle challenges and opportunities to implement primary HPV screening and self-collection implementation in the U.S. To really start to, and I want to emphasize the word initial priority areas that the roundtable and work groups should be leading as it relates to both self-collection and primary HPV screening. And we hope to continue to refine and solidify those priorities through conversations like the one that we're going to have today. And that partners left with a call to action regarding these two very important areas. You see Dr. Michelle Kahn, who was one of many esteemed presenters. And every single presenter gave me another note to take or another idea to really think about to advance our kind of shared vision and initiatives. So I'd like to think of that as the room where it happened, part one. And today I think of it as the room where it happened, part two. So no decisions have been made. Nothing has been finalized because it can't be without the input of all of you that are on the call today. And as usual, Shelley has set up a really nice format after our remarks to be able to try to get that input and feedback. Next slide. So I'll start first with our self-collection work and how that went, but you'll see kind of a similar theme, which is that through the ongoing discussions, the work groups have had that we've had over the years, we had some big picture ideas of key topics that we knew we wanted to address. I really loved that we started with a not reinventing the wheel type of approach, which was inviting a speaker from the colorectal cancer roundtable to really think about the lessons learned from their perspective in terms of school-based colorectal cancer screening and how those might apply and how they might be different than the areas that we're working on. We also thought about, as a national a priority and area, what would be a US delivery model for self-collection. So you'll see those blue boxes, which are kind of the big primary areas, and then where we thought more deep dive and discussion was needed, we would break out into smaller tables to discuss the areas that you see in green. So just to walk you through the US delivery model one, we then looked at what would delivery look like for kind of most current, hopefully soon future state, which is under the instruction of healthcare worker or in-clinic collection. But we know that there's also a desire to think about at-home collection. And so how do those two things compare and contrast? And I'm sure you all have ideas and perspectives. We thought about the many pathways that are needed for communication and implementation. And as you can see, the list is a condensed version of all the key stakeholders that really need to be engaged in order to advance our shared agenda. And I would say every table had a really robust discussion about how their particular segment or group was contributing to implementation of self-collection. And in a few slides, I'll present some of the summaries of those discussions. Next slide. We also had great presentations. I know for me, it was very instructive to hear from our SHIP trial colleagues at NCI, as well as some of the sites that are participating, to help get a better lay of the land of what the SHIP trial is and is not, and what are the questions that it's setting out to answer and in what time frame. True to ACS, we always have a fun one, which was choose your own adventure. And every single one of these is definitely an adventure in and of itself. And I really appreciated that we had sort of very tactical ones. And then I think one thing that I always think about with our work groups and roundtables is, how do we know if we were successful? And what does success look like with a group like ours, as well as some organizational mapping, developing a really comprehensive list of key organizations that really need to be at the table for self-collection. Next slide. The approach that we've been using ever since I joined the roundtable at ACS and took on the role of tri-chair has been one where equity is not something separate, but is really woven through the fabric of any meeting or any topic that we're talking about. And so we had a joint session that focused on health equity. Next slide. And we really tried to think about it in terms of what would be a framework that would resonate in the context of self-sampling and also primary HPV screening. We wanted to know what already existed. As you saw, we brought a lot of partners and stakeholders to the table. And so learning about some of the ongoing initiatives or efforts around education, in-clinic types of changes, et cetera, so that we could also have a group that thought about what are the initial steps. If we had to take a few baby steps forward to get to that big picture of health equity, what does that look like? And who should be responsible for implementing the recommendations around health equity. Next slide. Primary HPV screening was sort of last but not least in terms of our discussions. And so you'll see a very similar format in terms of the way that we structured. We used a series of case studies to identify what the needs are in terms of tools, and then what are the gaps. We did identify a lot of gaps. But I think what's good is that we were already prepared from the discussions that we had over the other days to see, all right, what can we deploy? Where are there communities, organizations, expertise that we can leverage to address these gaps? And always thinking about who is, some of you may have heard of the RACI model, which stands for Responsible, Accountable, Consulted, and Informed, when you're trying to get to achieving an outcome. And so who is the R for addressing the gaps and what the needed tools are? We did another case study looking at misinformation. So I think even just from the perception of the general public, when we say self-sampling or primary HPV screening, some people may have a certain operational definition or idea of what that is. And so to make sure that we're really clear about what primary HPV screening is and how we as the roundtables and ACS can help to address that. And finally, with regard to primary HPV screening, it was really the dissemination of results. We had a similar approach where we did a choose your own adventure. Some of my favorite topics in terms of data collection, where are industry potential partnerships, the age-old question of how do we know we're successful, and anything else we may not have considered. And we heard some great examples of from physicians themselves who had already implemented primary HPV screening in their clinic. And they gave us some really good ideas and food for thought about what does change management look like for clinical organizations as they're moving to primary HPV screening. And as you can see, we came up with some important ideas around how could we make sure that others sort of share the lessons learned. So for example, that third box of developing a playbook of if you as a clinic or an organization want to move to primary HPV screening, and what are the considerations and who are the key players, et cetera. And so really building kind of the clinical infrastructure and support to be able to do primary HPV screening in a real world context and setting. Next slide. So that was the big picture overview. As you can see, we had 3 days of discussion, and I was going to say 3 long days, but it went by pretty quickly because I think most of the days were filled with conversation and engagement as opposed to listening to multiple presentations. The presentations were all spot on and really helped to fuel the conversation that we had during the working tables. So what were the overall themes? One that our HPV vaccination colleagues probably also understand and appreciate is the need for a clinical champion. So how can they help in terms of that roadmap to implementation support? How can they help in terms of connecting to peers, advisory groups, networking channels? There was also a strong element of logistics and systems change. The real nuts and bolts of how would we implement a home-based or clinic-based, a clinician-supervised type of approach, and how do we disseminate these resources? There was a lot of conversation, maybe because we started with our colorectal colleagues around bundling screening. So how are we trying to give all of the most health promoting strategies and information at one time rather than trying to break apart, sort of just cervical cancer screening, but also include self-collection. And also, how do we bundle with other approaches to well women education? We talked about different players like pediatricians who have a strong focus on HPV vaccination. Are there potential partnerships there? Mobile screening and also worksite interventions. Educational campaigns came up many, many times to many, many different audiences, certainly for the general public and re-educating around what the cervical cancer screening process is and how we might have to decouple or reteach what cervical cancer screening looks like as opposed to the annual PAP as kind of the message that we're sending. But the other group that equally needs support and education are providers and other healthcare professionals, so that they are aware of what potential questions their patients may have, and also, how can they make sure that they're presenting sort of the most accurate, up-to-date information. And underlying all of this are what are our data needs. Akiva's not here, but I'm channeling him for our National Cervical Cancer Screening Registry and what a game changer that would be if we could emulate our colleagues in New Mexico. And then we also had an interesting series of discussions around data visualization and how we might be able to use GIS types of tools to identify colposcopy deserts or areas where there's probably greater impact or reach if we can do some sort of a distributed model in terms of self-collection or primary HPV screening. So those were kind of the high level overviews. And now I'm going to turn it over to Debbie to kind of think about action items and where we go from here.
Thanks, Susan. So yeah, one of the great things about ACS National Roundtables is you go to a meeting and then come back, and that's just the start of things. There's a whole list of action items that come next and continue. So some of these are within the roundtable staff team. Some of them are for the work groups that hosted this summit, and many are for all of our members, and so everybody on this webinar. And of course, one of the first things we did was set up this webinar, this call, so that we could let people who weren't in the room in Chicago know what happened and hear from you, and then allow you to interact with each other on some ideas for going forward. The next couple of items are similar. We would like to set up channels and have started to do so, but it's not quite ready yet, to have forums for anyone who's working on research in self-collection and or implementing primary HPV, to be able to talk to one another and to be able to house materials that maybe are being created that could then be shared. So not everybody has to create their own. We talked about creating an advisory group to help in real time, sort of like a rapid response team, to help health systems and plans and labs who are looking to transition to primary HPV and self-collection have a place to go to ask questions. We had some fabulous case studies at the summit, and that was great for other people to hear, okay, this was one person's experience. We are currently collaborating with the American Cancer Society on key messages for all the various audiences as we anticipate FDA approval of self-collection. One of the strengths of a national roundtable is to help all the different organizations in the space speak in similar language and say the same thing. Communication and dissemination plans. Once we hear from the FDA, there's going to be a lot of groups who want to get the word out. There's going to be a lot of questions. And so the roundtable can help coordinate that. Steps Guide is one of the most popular products out of roundtables and also other areas of ACS. It's a very concise online or print document that basically has the few key steps for doing whatever it is you want to do. In this case, transition to primary HPV and prepare for self-collection, with links to all the materials that are going to be needed at any given step. We continue to add to the Roundtable Resource Library. I hope you've bookmarked that page and checked it out, and continue to do that, because resources are constantly added. Capacity building. So this again goes back to the American Cancer Society. We will be offering training and resources to the hundreds of ACS staff located around the country who work with health systems and many of your constituents. So we want to make sure that they're prepared to answer questions about transition to primary HPV and self-collection. And finally, to take what we learned at the summit and use it to inform what the different work groups will be doing. So we know that obviously 2 of our work groups, primary HPV and self-collection, have direct opportunities and activities coming out of this summit, but there's also a place for each of the other groups, for patients, for providers, for stigma, for policy, and elimination. So we want to make sure that there's a lot of information that's shared across and within work groups.
Thank you very much. We do hope that you will walk away with this call to action to implement the ideas that you shared today in the breakout room, and then to share your successes back with us at the roundtable so that we can amplify and share the work that you've done. Of course, you can always reach us by email, or you can go to our website or scan this QR code to fill out a form with your success story. Thank you all for your time. We appreciate it very much.
Thanks, everyone.
Thanks, everybody.